Welcome back, my people. Welcome to the second part of our discussion today, whereby we are still covering about sexually transmitted diseases. So, under sexually transmitted diseases, we covered PID or pelvic inflammatory disease, we covered cancer, and we covered tertiary syphilis. So, in this video, we will start by covering genital warts. And before we continue, guys, if you are there and you are looking at this video and you have not subscribed, just hit the subscription button, put the notification bell on so that whenever we post any video, YouTube will notify you and you will never be left back. So, thank you for the ones who have subscribed and those who are commenting, liking and sharing our content. So, let's get to business. And now, we'll be talking about genital warts. Genital warts. As I have said before, for those who have been following my content, all my videos, this is just a repetition. I had a client who requested we discuss about warts, and I discussed about it in deep. So you will be finding that in most cases, some of the diseases will come as a repetition in other topics. And we have to cover them and we have to repeat them if need be. So, genital warts. Some lower risk strains of human papillomavirus. In genital warts, some lower risk strains of human papillomavirus can cause a disease called genital warts. So, in simple terms, genital warts is caused by lower risk strains of human papilloma virus. So, these skin colored or white bumps show up on genitals, or vulva, or anus, with over 350,000 people developing them every year. So we have more than 350 people developing genital warts each year. So genital warts are treatable but not curable, as the virus can always recur, or as the virus that causes them may remain, but in some cases, human papillomavirus disappears on its own. As we discussed before, if your immune system is strong enough, you will be in a position to fight any virus without necessarily having any kind of treatment. So, genital warts can go away by themselves but can come back if you can. So they can go away by themselves and can also come back by themselves. So if you want to get them, if you want to get away with them, the options range from freezing. If you want to get away from them, removal of options range from freezing or burning them off by applying a chemical, cream or liquid. And we discussed this broadly when you are talking particularly about warts. So let's come to the next disease, which is classified in sexually transmitted diseases, and this is AIDS, or acquired immunodeficiency syndrome. So, HIV virus can damage immune system and increase the risk of contracting other viruses or bacteria and developing certain cancers. This means HIV can predispose a person to cancer simply because it damages your immune system, and when your immune system is damaged, you will have no security for your body. So any disease can enter your body, including the ones we call opportunistic infections. So if left untreated, HIV virus lead to AIDS. Human immunodeficiency virus can progress to acquired immunodeficiency syndrome or AIDS, where the body becomes vulnerable. The body becomes vulnerable, or in other terms, the body becomes at risk to serious infections and illness simply because you don't have any defense in your body, or rather your immune system is compromised. So people with AIDS may experience the following. People with AIDS may experience the following. 1. Rapid or fast weight loss. Number 2, extreme fatigue or tiredness. Number 3, sores, including the one for herpes zoster or herpes simplex. Number 4, infections. As I have said, opportunistic infection will always set in due to the low immune system or compromised immune system. Number 5, neurological disorders. And number 6, cancers. A point to note: no cure is available for AIDS or acquired immunodeficiency syndrome. No cure. So, no cure due to the variety of diseases that can be contracted as a result of severe or weakened immune system. So, AIDS has no cure due to the variety or the many diseases that can be contracted as a result of severely or weakened immune system. Another point to note: life expectancy for a person having AIDS / HIV is only 3 years if he or she is not on treatment. This means if you contract HIV virus or AIDS, you can only live for 3 years without treatment. But with the treatment, you can live for several years. So, let's discuss about sexually transmitted diseases and pregnancy. Some sexually transmitted infections can be transmitted to fetus during pregnancy or a newborn during childbirth, but not in all sexually transmitted diseases. So, some sexually transmitted infections can be transmitted to a fetus during pregnancy or a newborn during childbirth, but not in all sexually transmitted diseases. I hope you get that. Another point to note: syphilis can be passed to an unborn baby, resulting in serious infections, miscarriage, or stillbirth. Those are some of the complications of the diseases we have discussed under sexually transmitted diseases. Another point: genital warts can also pass to a baby, but it's rare. Another point: pelvic inflammatory disease can affect future pregnancies, making an ectopic pregnancy more likely. This is the pregnancy at the fallopian tubes. So, pelvic inflammatory disease, and we discussed about it previously, can lead to ectopic pregnancy more, and it can make ectopic pregnancy more likely and causing infertility in 1 out of 10 people. So, what should you consider when pregnant? Or what should you do when pregnant to avoid sexually transmitted diseases? Number 1, get screened for sexually transmitted infections. For example, HIV virus, syphilis, to avoid complications and to get early treatment. Obviously, if you get treated earlier, you will avoid the complications of these diseases. Number 2, speak with your healthcare professional if you have sexually transmitted disease, and he or she may decide if to continue treatment or delay depending on the safety of the treatment to the fetus. So if you are pregnant and you have a sexually transmitted disease, you will talk to your healthcare provider and he or she will decide whether to get you on treatment or to delay the treatment past delivery, depending on if the treatment will be safe to the fetus or the baby in your womb, and if it may cause some risks to the baby, he or she might decide to delay it until you deliver. Then after delivering, you get treatment. Another point, cesarean section delivery may be needed. For example, if vaginal warts make it difficult for the vagina to stretch, cesarean section delivery may be considered. For example, if vaginal warts make it difficult for the vagina to stretch, because it has to stretch for it to let the baby out of the womb. This marks the end of our second video or our second discussion today. Guys, thank you for the support you are showing me. I do appreciate a lot. May God bless you. Let's continue liking, subscribing, and sharing our videos and keep the support on. If it were not for you, this channel could not be where it is. So, everybody of you, everyone, make sure you hit the subscription button so that whenever I post any video, YouTube will automatically notify you and you will never be left behind. Let's have a good evening all.